Nigeria, like many other nations, is experiencing a demographic shift with an increasing proportion of its population entering old age. This demographic transition brings along a rise in chronic diseases such as hypertension, diabetes, arthritis, stroke, and various forms of cancer. The prevalence of chronic diseases among older adults becomes a significant concern, especially in the northeastern zone with the largest physical size and population. Dr. Olajide Olagunji of Potiskum Medical Center, PMC, Yobe State, is one of the Nigerian health practitioners committed to making the future bright for the elderly, whose researches and practices in this regard focus on addressing and reducing the burden of chronic diseases among the aging population, particularly in Yobe State.
What motivated me to focus my study on the older adult is that I realize that this is a particular demographic that is often suffer neglect. People don't actually pay close attention to them because to the larger population, they are old, they are frail, and at the most, people believe that they are no longer productive. But most of these people have worked their entire life for us. Most of these people have sacrificed their entire life, their entire career for us. And while working tirelessly, most of them have not even paid attention to their health. Most of them have been managing a lot of chronic medical conditions for years. Most of them have been in this terrible situation and they don't know. Some of them have hypertension, some of them have diabetes, but because of the fact that they are consumed with the zeal of their work, they have paid little or no attention to their health, and these things have stayed in their body for a very long time and has become a chronic condition. So by and large, as they old and the general immune system of the body goes down, most of these things manifest more. And I feel that if you can pay close attention to these people that have spent majority of their life working for us, we will be able to significantly reduce the burden of chronic disease, especially in Yobe State, Nigeria.
The medical expert identified strategies that can reduce the burden of chronic diseases in the elderly population in Yobe State, which has suffered from the devastating effect of Boko Haram insurgency, socio-economic conditions, health literacy, amidst almost non-existent all-people-focused programs, cultural and societal nuances, as well as insufficient healthcare facilities and resources, among others, which need to be considered in crafting targeted strategies to address chronic diseases in older adults effectively. According to him, improving healthcare facilities, implementing community-centered programs, recognizing and respecting the cultural diversity, public awareness, and other strategies are necessary for the state to significantly address health challenges of the old age.
There are a few ways we can really get at work and get things done and dusted at this level. One of those ways is by improving the healthcare infrastructures in Yobe State. Yobe State is blessed with a lot of health facilities, both primary, secondary, and tertiary. All we just need to do is to improve on all these health facilities, get the state-of-the-art equipment, get enough testing kits for them, and we'll be good to go. Also, I feel that we should start community-centered programs. For instance, we should bring healthcare directly to remote areas. Yobe State is one of the states in Nigeria that has the largest rural areas. There are a lot of areas where there are limited medical practices and adventures going on. So I feel if we can bring our medical practices to all this rural environment, community-based medical practice, community-based outreach, rural outreach, we are going to be able to significantly help this demographic. Also, we should also put into consideration the cultural sensitivity and customs in Yobe State. Yobe State is blessed with a lot of culture, and all these cultures, majority of them believe, we have different beliefs, and if these beliefs are not put into consideration, we will not be able to get to the root of this matter. We will not be able to take healthcare practice to these elderly people and give them what they actually require. Also, public awareness program. We need probably a lot of public awareness program campaign in Yobe State. We need to let people know the state of their health. We need to let people know what it is actually they are battling with. Doing this, we are, and in our efforts to do this, we must try as much as possible to prioritize preventive measures. Let people understand that eating too much of a particular food is not good for them. Let people know that paying attention to their health is important. Let people know that from the beginning, it is better to get things tested so that they can live a longer and a healthier life. Then also, we need governmental collaborations. We need governments to come into play for us. All these things I'm just talking about are things that require money. And if we don't champion policies that will make government to see reasons to release money for the care of the elderly, we will not actually be doing enough for these people. So I think reducing the burden of chronic diseases in Yobe State, if we focus on the elderly population, we're going to be making a giant step towards this. And I'm so sure that at the end of the day, we'll all be happy for taking care of our adults.
A strategic approach to reducing the burden of chronic diseases among older adults in Yobe State requires a nuanced understanding of the local context and a commitment to collaborative efforts by enhancing healthcare infrastructure, implementing community-centered programs, considering cultural sensitivities, raising awareness, and advocating for supportive policies. Yobe State can pave the way for a healthier and more resilient aging population. Through these concerted efforts, Yobe State can ensure that its older adults not only age with dignity, but also enjoy an enhanced quality life.